the current COVID-19 situation in the state of Michigan, not quite as severe as it is in many of our neighboring states, but still a very concerning situation with the majority or almost all of Michigan counties classified by the Centers for Disease Control as either being in a high or substantial rate of spread. We're pleased to be joined now to talk about how that's affecting our hospital systems with Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Dr. Malhotra, thanks for being with us today.
Thanks for having me.
Appreciate having you on. So right now, specifically at Henry Ford West Bloomfield Hospital, but really across the health system, what is the current status in terms of the hospital's ability to deal with all their regular operations and their emergency operations, but also with the growing concern of the COVID-19 situation in southeastern Michigan, particularly as it pertains to the Delta variant?
Yeah, thanks for asking. The situation in the hospitals in this region is, I would say, clearly not as bad as a lot of these states that you hear more about in the news in the South, Texas, Florida, California. However, the hospitals are starting to see a strain. I would say that currently, pretty close to about 10% of our beds are being taken up by patients that are COVID positive. That may not seem like a lot, but when you take into account the fact that most hospitals don't have a 10% reserve to absorb those patients, it does put a strain on the system. I think, we're lucky that we're in a position to continue to be able to provide safe care across the board. We have the staffing that we need to get through, but I worry every day about, the state of the people who are working in these conditions in the pandemic. The frontline nurses and doctors have been doing this now for 18 months, and it takes a real strain. You can do it for a day, a week, a few weeks, running at that level of anxiety, stress, and strain, but to do it for 18 months is a long time. And, I think when you put the strain of the pandemic in, juxtapose it next to the huge nursing shortage that is being felt across the country, we're in a very precarious position, and everything that we can do as a community to help us get out of the pandemic is going to be helpful.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital with us on the MegaCast. You mentioned that it does take a toll across the board, not just on the medical officials, whether it be doctors, nurses, physicians' assistants, whatever the case may be. It also takes a toll on the general medical care that does go on a regular basis at these hospitals. What are some of the ways outside of the treatment of COVID-19 and the staffing and the stress that's put on those that are on the front lines? What are some other ways that our hospital systems are affected by these surges in COVID-19 cases and hospitalizations?
Well, the CDC just released information about the fact that hospital-acquired infections are on the rise across the country. Now, you can speculate about the exact reasons for that. With the influx of COVID-19 cases, the average patient is sicker, and that obviously contributes to this. But also, the resources are spread out more thinly, and that takes a toll. So, that is a very concrete and recently studied way that the pandemic is affecting not just the people who are diagnosed with COVID-19, but even other patients that are requiring care. And this says nothing about the toll it's taking on the mental health of the community at large. And I mentioned frontline clinical workers because that is what I see day in and day out. But when you talk about support staff, there is a huge toll on the support staff as well. For people in environmental services and food services, working at a hospital at the same pay as working at a fast food or some other job where the exposure is more limited is very tempting. So we've got people who come into work every day, expose themselves to a higher level of risk on a daily basis. They do it because they have a passion for it. They are driven by a need to try and help people. But as a community, it's our job to try and pull ourselves out of this as quickly as we can.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital with us on the MegaCast today. And in terms of the current outlook in Henry Ford hospital systems and their facilities, among the 90 COVID patients at Henry Ford hospitals, 84% of them are unvaccinated. 90% of patients in the intensive care unit for COVID are unvaccinated. On the other side there, with the medical officials and those working on the front lines, 92% of team members have received at least their first dose or are fully vaccinated. So with that being the case right now, with the vast majority of COVID patients in Henry Ford hospitals currently being unvaccinated. And we've seen reports over the past several weeks of numbers from not just Michigan, but other states throughout the union that a large number of these new COVID-19 cases as a result of the spread of the Delta variant are among the unvaccinated. Knowing that that one variant leads to another variant, leads to another variant, and there's always something different with each one that makes them a little more difficult or trickier in some ways to navigate, how much more important now does the medical community state the urgency for those that are unvaccinated to either get vaccinated or reconsider their apprehension?
Yeah, thanks for asking. I think clearly the level of urgency appears to be much higher now, and I think the reason for that is that the variants are becoming, more infective, and there's evidence to suggest perhaps more severe. But it was always this important because this is the only way out of the pandemic. And what I mean by that is these variants aren't just random things that are happening in a vacuum. This virus replicates in humans, and the more cases there are, the more opportunities that virus has to have a mutation that could potentially be dangerous. So by getting vaccinated, by decreasing the transmission of the virus, we actually decrease the ability of the virus to create more dangerous mutations. So we've always strongly suggested that people get vaccinated. I think it's essential. It's the only way out of this. But with what we're seeing in some states right now and the critical situation with beds, obviously there is a heightened concern. And as these variants get more and more infective and potentially less affected by the vaccine, we may find ourselves in a situation where we're again way behind the ball trying to catch up with the mutations. Currently, we're lucky enough that the vaccines that we do have are very, very effective, and I mean over 90% effective when it comes to preventing hospitalizations and death. And those are really the primary outcomes that we're looking for. There is some data out there that the effectiveness of these vaccines against transmission is lower than it was previously, but still obviously way, way higher than for the general public. So if you look at the data and you look at where the deaths are occurring, I think it's obvious that the vaccines continue to be extremely effective. And, for those people who do have concerns about side effects or long-term side effects, I can tell you that we are not seeing an influx of people coming to hospitals with side effects. We're just not seeing that. I mean, this is one of the these are some of the most safest vaccines that we've seen. And when you look at, the risks of side effects, even long-term side effects, we know that COVID-19 has a significant component of patients that end up with long-haul symptoms. These are symptoms that don't just go away when you recover from the acute infections. We have had friends, employees who are dealing with very long-term symptoms, and things like long-term loss of smell and taste may seem not like a big deal by hearing it, but for people who want to enjoy their food, that's a huge, huge loss. Long-term symptoms that are neurological in nature can cause difficulty in concentration, make it difficult for people to do their jobs. So there are known long-term symptoms from COVID-19 infection. There are no known long-term effects from the COVID-19 vaccine, and the way the vaccine works, there's no reason to believe there should be long-term side effects.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital with us on the MegaCast to talk about the current situation in our hospital systems, particularly Henry Ford, in terms of how they're being affected by the recent surge in COVID-19 cases, with most of Michigan's counties, almost all of Michigan's 83 counties, classified as high or substantial spread of COVID-19 at this moment in time by the Centers for Disease Control and Prevention. And Dr. Malhotra, a lot of this comes down to the spread of information and also the spread of mis- and disinformation about the vaccines, about COVID-19, and a number of other things that are affected by this pandemic. And so a lot of the initial advice people get about clearing up the confusion is, well, speak to your doctor. But the fact of the matter is, not everybody has a primary care physician, or not everybody can go ahead and seek information from a doctor that they would regularly see. For those that cannot do that, at least through Henry Ford's health system here in West Bloomfield and through all of Metro Detroit, what's the best avenue for them to go through to seek that advice from your health system?
Yeah, so we have information and frequently asked questions answered on our website. Obviously we recommend calling your primary care physician because you may have a relationship and have the trust that's needed. But, there's information available at the CDC website. There's information available on our website. So I think making sure that you're getting your information from trusted medical sources is the key here. I think one of the biggest problems that we've run into is medical sources of information are being lumped in with any source of information, and people are finding conflicting information on vaccine efficacy, on vaccine safety, on the COVID-19 infection numbers, death rates, and it's all being lumped in together. And I think it's very important to separate out the scientific facts than the conjecture and some of the information out there that is blatantly misinformation. So, you've trusted your doctors to deliver your babies. You've trusted them when you're sick. So I don't think this is the right time to decide that, that you don't trust the medical institution. Physicians, nurses who are working in hospitals are not in any way benefiting from COVID-19. They don't get any benefit from getting people to take the vaccine. I think one of the questions I recently got was, the vaccines are huge moneymakers for the hospital, and the answer is they're not. The medications that we give for the care of COVID-19 patients don't change how much the hospitals make. So we're trying to make decisions based on the latest science, and the latest science, again, shows that the vaccines are remarkably effective in preventing the severe disease, hospitalizations, and death. And that is the best way you can protect yourselves and protect your loved ones.
Find more information on COVID-19, information from reliable sources such as the CDC, the state of Michigan, and Oakland County by going to our website at civiccentertv.com/coronavirus, where you can click on the Oakland County page, and it'll give you the number for the Oakland County Nurse on Call, which we will also give you now, 1-800-848-5533, 1-800-848-5533, that you can call for more information on COVID-19 vaccines, to get some of your questions answered. If you don't have a primary care physician that you regularly go to for a number of different reasons, or you can't go visit a doctor at this time, they can answer those questions. And we also have on that link on our website to the Oakland County COVID-19 page information of how you can text and email the Oakland County Nurse on Call about COVID information as well. We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital with us on the MegaCast. And Dr. Malhotra, we've heard a lot over the last couple of weeks, really, about people seeking alternative treatments, for lack of better terms off the top of my head, for COVID-19, particularly those that are not vaccinated. Things such as ivermectin, which is a known horse dewormer and is not suggested by the CDC to be used as a treatment against COVID-19. But there are other treatments that are suggested and are being utilized by those in our medical community to help people treat the COVID-19 symptoms. What are some of those much more effective and safe methods that are being utilized?
Yeah, I think it's an interesting one that you brought up. I'm not sure why ivermectin has gotten so much support, but repeatedly um, uh, most of our science that we have on this, the research that we have on this, is very, very inconclusive about benefits and is pretty conclusive about risks. So that is certainly not recommended. There are a number of other treatments that we use that are better. Studied, whether it's antivirals or steroids, and there is a protocol that is designed for each hospital, and that is something that we are very, very committed to making sure that we follow. There's a lot of pressure to use some untested treatments, going to the point of actual court cases. There was one recently in Ohio where ivermectin was upheld and then now has been reversed. And we'll continue to make sure that we're following the science when it comes to treatment.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. And lastly, with just a few more minutes remaining with our time today, Doctor, I want to talk about the COVID-19 boosters. At this time, who should be seeking a potential booster shot against COVID-19 if they are fully vaccinated? And why are we seeing this being urged now for these certain populations?
Yeah, so if you are immunocompromised, a cancer patient being treated with chemotherapy or had it recently, certain subsets of populations are being urged to get that booster, and that's who it's approved for. The reason that we're seeing this is, one, the folks who are immunocompromised have not would be at risk of not mounting as strong of a response as a person with a normal immune system. So after their first and second immunizations, their response would not be as strong. And this is meant to augment that. We have evidence that a second booster does augment the immune response. For people who are normally have normal immune systems, there is not a consensus yet. We are seeing some data out there that the effectiveness and the antibody levels tend to drop off as time goes on, suggesting that a booster may very well be likely potentially for all populations, but that has not been recommended at this time, and we are not recommending or providing boosters in that context, only for the recommended populations, which includes the immunocompromised.
Dr. Malhotra, we've been pleased to be joined by you today. Before we let you go, anything else that would be important for our audience to know about COVID-19, about the situation in our hospital systems, particularly Henry Ford Health System and here in West Bloomfield, before we say goodbye?
Yeah, I think it's important to note that even in states where the toll is not as high as we're hearing about, as I mentioned before, Florida, Texas, and some other states, it is still taking a toll. And depending on which community you're in and which hospitals you rely on, even an additional, 10 to 15% of patients being admitted to the hospital can increase wait times in the emergency department and can really strain the folks taking care of patients in the emergency department and the hospital. So the best thing that we can do in the community is to make sure that we are getting vaccinated. There are, now we've given over 300 million doses of vaccinations in this country, and the safety data is really unimpeachable. The other thing that we probably need to keep doing in most circumstances is masking in public areas. This is for some reason become quite controversial, but the reality of it is there's plenty of data to suggest that masks decrease transmission, and none practically to suggest that there's any harm to the average person by wearing a mask. So masking, especially in situations where you're indoor in large groups where it's difficult to socially distance. That is one end of the spectrum where it's extremely important to make sure you're masking, all the way to the other end where you're in a sparsely populated outdoor area where you're able to socially distance and everybody's vaccinated. That's probably one of your lowest risk situations. But I would certainly recommend anybody that's indoor where they're not able to socially distance, they should be wearing masks. And those are the things that we can do to make sure that we're keeping ourselves safe, and more importantly, keeping our loved ones safe, especially the people who are most at risk of poor outcomes.
Well, Dr. Malhotra, we appreciate your time. We know you're busy. You got a lot going on right now at Henry Ford West Bloomfield Hospital. But thank you for taking the time today to join us and talk about these really critical issues that are affecting our communities with COVID-19, but also those on the front lines that are helping us fight this virus.
Thank you a lot for having me.